I didn't take anybody from this side or from back here. Yes.
Mayor, I know you just spoke about your health care plan. Can you tell us what your vision is to make health care affordable for all Americans?
Yes. How would you make health care affordable for all Americans? It kind of connects to the answer I was giving you. It's exactly the opposite of making more people dependent. If the government takes over any more health care than it's already taking over, we will make health care so expensive that nobody will be able to afford it, and we'll make it inadequate. That's the forces that are making American health care too expensive and less quality-driven are the government and large employers buying insurance for people instead of people buying their own insurance. What we need is a much bigger market of empowered consumers who are buying their own health insurance. Now, how does that help people that don't have health insurance? The liberal media has a really hard time with this. How does it help poor people? How were they able to afford a television set, a radio, or a cell phone? When they all came out at first, they were too darn expensive even for middle-class people to afford. How did it turn out that middle-class people and lower middle-class people and poor people can afford all these things? They went down in price, right? Whenever these new technology things come out, you know this iPod thing, this new iPod thing, the kids, I'm not a real expert on this, but this iPod thing came out. I had some kids say to me, I'm going to wait a year to buy it because it'll be a third of the price. I said, these kids are capitalists. These are smart kids. They're going to be very successful someday. They just figured out how the American economy works. Because all those people that go out and buy it at first drive the price down. They drive it down. See, you start off with the price of one of these plasma TVs, $15,000 when it comes out. Nobody can afford it. Now, there are a couple people that afford it. They pay $15,000 for it. The manufacturer figures out, if I bring it down to $12,000, I get more people to buy it. I make less per set, but a lot more on volume. So now it goes down to $12,000. Then it goes down to 10 when more people buy it. Then it goes down to 8. Then it goes down to 6. The plasma TV I looked at last week in Iowa was $3,000 that had originally been $15,000 just 5 years ago. Now people who are not so rich can start to afford plasma TVs. Some TVs are down to $100 and $200. So that's not happening with your health insurance. Your health insurance is being controlled by government and big employers. And there aren't all these consumers out there looking to buy low-cost volume products. If we had that, we would see the price come all the way down. We would see the volume come up. That's an American solution of the problem. What Hillary wants to do is not an American solution to the problem. It's a solution that marches us, and boy do they get angry about this, but sometimes the truth hurts. It marches us right to socialized medicine. It's the reason why they all like this new movie by Michael Moore, Sicko. You know, it's an appropriately named movie. And what the movie's about? How healthcare in Cuba is better than healthcare in America. Oh, it's better in... Okay, I'm going to tell you about England. I'm going to just give you a practical question. That medical care is better in England and Germany and Italy. You should have read the Wall Street Journal article just a week ago from a doctor in Italy who explains how terrible health care is in Italy. But here's the practical test. Here's the practical test of which is better. How many people do you know who need a heart operation or a cancer operation that go to Canada? Those places they've ever heard of coming here. I think it's like 1,000 to 1. How about 1,000 to 0? Nobody goes there for medical treatment. Everybody comes here for metastatic cancer. The survival rate, for me, in the United States, is 82%. That's the survival rate for all prostate cancer in the United States now. You know what it is in England? 44%. I like the 82% better. Thank you.